Hi class, today I'm going to go ahead and do tracheostomy care for you guys. I'm going to go through a couple of the things that you will need for this skill. The first thing you will need is a tracheostomy care set. You will need a pair of sterile gloves. You will need a blue chucks or a towel to place on your patient. You will also need a pair of just regular gloves, clean gloves. You will need a face mask, preferably with a face shield. You will also need a red bag to collect your dirty supplies. Okay, so before I begin this skill, of course I'm going to go ahead and do my day wipes. I'm going to wash my hands, introduce myself to my patient, and explain what I'm going to be doing for him. I'm also going to do a respiratory assessment on him as well. I'm going to put my patient in a comfortable position to do this. So a semi-Fowler's position is an okay position, and I want to make sure that my bed is at a working height and that the side rail is down so that I can reach my patient. So we are ready to begin. I'm going to go ahead and put my blue towel on my patient to collect any secretions that might come out from the TrachCare site. I'm going to go ahead and place my face mask on, but for CPEs, again, you will just verbalize this. You won't actually have to do it. So I've got my face mask on. I am going to go ahead and put on my clean gloves. First thing I want to do is to go ahead and take out the old dirty dressing around the TrachCare site. Move this down so that you guys can see what I'm doing here. Okay. Very gently pull out the old gauze, and I want to inspect that and look at it for any drainage. Notice if there was any odor or anything to indicate that the patient might have an infection. Alright, so I'm going to take that, wrap it up, throw it into my dirty bin. I'm going to go ahead and wash my hands, and I'm ready to begin. I'll go ahead and open my TrachCare kit. Okay. I'm going to go ahead and put my sterile gloves on. And again, I want to make sure I wash my hands before I do any of this. If you happen to break sterility during CPEs, just verbalize that and just tell us what you would do should you do that. So if you happen to put your gloves on and break sterility, just say that you would get yourself another pair of gloves. I'm going to go through what's inside the kit now. There should be a sterile field that you could set up to work with. Just grab that out, set up your sterile field. Remember your 1-inch margin. Either side can go up or down, up to you. In your kit, you will find 3 Q-tips. I'll go ahead and set that on my field. 2 pipe cleaners. You should find 3 pieces of gauze. A split gauze to put around your trach site at the end to replace the one you took off. You should also find a blue collar. This goes behind the patient's neck because if you notice on your patient, the patient will have ties to keep his tracheostomy in place or his trach in place. At the hospitals though, a lot of times you will find Velcro in place of this, but for CPEs I'm going to show you how to use that. You will see some ties for replacement. Also inside your kit, you will have some sterile saline solution. That belongs in one compartment. You will notice that you will have 3 compartments in here. So the saline goes in one compartment. So you'll open that up, pretend to pour it in, and you just set it in there to give yourself a or a visual reminder that it's there. You also have 2 hydrogen peroxides. Open, one goes in the second bin, and you open this one or pretend to and put it in your third bin. You also notice you will have a scrub brush in there for cleaning the inner portion of the cannula. I like to leave mine in there as a visual reminder to myself that that's the first one I will use. So notice that I am sterile still. I'm going to go ahead and take out the inner cannula because now I'm ready to begin the cleaning procedure. With my dominant hand, I'm going to go ahead and unlock the inner cannula and pull it out, being careful not to touch anything. All right. And I'm going to go ahead and dip it in my hydrogen peroxide solution, the first one with my brush. I'm not going to drop it in there, I'm just going to hold it. I'm going to go ahead and clean the inner portion, clean the outer portion, and then I'm going to go ahead and just leave that in there. And I'm going to take my saline and I'm going to rinse it. I'm going to tap the sides of my inner cannula to get the water that might be on the inside of the inner cannula out. And then I'm going to go ahead and place it back into the patient without touching anything. Okay. And the inner portion of the cleaning of the cannula is now done. So all I have left to do is my top and my bottom plate as far as cleaning. Alright, so it doesn't matter whether or not you want to clean the... I'm not touching this hand, okay? It doesn't matter if you want to do the top plate all first, wash, rinse and then dry, and then do the bottom plate, or if you want to go top, bottom, top, bottom, top, bottom. I'm going to go ahead and do all of the top and then all of the bottom, okay? So I want to go ahead and clean my top plate. What I'm going to do with that is take my gauze, and I'm going to do the wonton or the four corners with it. And with the hydrogen peroxide that I have not used, I want to go ahead and dip that in there, squeeze it out, and using the four corners, I want to get all four corners of the top plate. Okay, so I'm going to do one, and I'm going to turn my gauze, do the top portion now, because the mannequin is in a funny position. I can't get to the top plate without contaminating, but in the real world, you would want to get the top of the plate, turn your gauze, get the third part, turn your gauze, and with the fourth portion, go ahead and get the bottom plate so it's nice and clean. Throw out your gauze. After you wash it, you will want to rinse it. So again, you will take another piece of gauze, fold it, put it in your saline, rinse, and do the four corners again. Rinse, 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 rinse. And with your last piece of gauze, you will want to dry the top plate, again using the four corners. And if you imagine that your top plate is cut into four different pieces, so you go 1, 2, 3, 4 to clean. Okay, and now you're all done with the top plate. Now you want to clean the bottom plate. So with your Q-tip, you will take your peroxide again that you haven't used to clean with before, and you'll do 1, 2, 3, and 4, okay, to clean. In the real world, you will use as many Q-tips as you need to get the job done, because I'm telling you that normally one Q-tip is not going to do the job sufficiently. So you will just use as many as you need to. But the whole idea here is to go ahead and clean underneath the bottom plate. You will want to rinse using your saline underneath. Again, 1, 2, 3, 4, and then you will want to dry using your third Q-tip. 1 underneath the plate, 2, 3, 4. Okay. The last thing you need to do is go ahead and put on your new split gauze, and you will want to go ahead and just place that there. You can use your pipe cleaners. Okay, fold them in half to make them a little stronger. And you can just go ahead and get that started. And once you have the corner started, your sterile portion of your skill is pretty much over. So then you can go ahead and use both hands to grab the ends and pull it on through. Okay. Now, as far as the ties go, this will be one long piece for you, so you'll use scissors to cut it into a 1/3 piece and a 1/3 and a 2/3 piece. Notice that the tie is on this side of the patient, so you will want to fold this top portion over, cut a slit in the top so that when I hold it up, there'll be a hole right in the middle. I will want to fish the long portion through over on this side. Kind of hard to do with these gloves on, but the idea is to put the long portion on this side, the short portion on this side, Bring the tie on over and put the bow on the opposite side. It will be the last thing you want to do because you want to make sure that you do not take off the old ties until the new ties are on to keep it secure and in place. That completes the skill pretty much. So your last part of the skill is to, of course, clean up, document, and reassess your patient, and that ends trach care.